Welcome back, everyone. Carl Rosen and John Ditkoff, my friend and colleague.
They're no longer wild and crazy.
No longer. Today, we're going to talk about vitreous detachments, which really is a nice addition to our floaters video. This is a specific type that has more implications to the retina and to your eye health. John and I are both ophthalmologists. We're fellowship trained. I'm oculoplastics in Alaska. John's in New Jersey. We trained at Albert Einstein many, many years ago when I think, before electricity, but here we are. And just to let you know, floaters are super common. They say 50% of people over 50 will have a floater related to a vitreous detachment. Again, the jelly in the eye that separates from the retina and its attachments within the eye. Most notably,
we should talk about, so vitreous detachment is a very specific type of floater.
right.
So it occurs more with age. It occurs more, and it's a different pathophysiology, meaning the gel in the eye, floaters are little cells, little debris. But here we have the gel actually separating away from the retina. People can see this. Oftentimes they see a black bug or a spider web, and many times it's associated with flashes because the gel is pulling on the retina.
Right. And so, and this
tell us
gel,
some stats.
right. So this gel is made out of these fibers called collagen. It's actually type 2. Why do I know that? I don't know. But it's attached to the optic nerve, the macula, blood vessels, and the upper edge of the eye called the ora serrata. I'm going to show a diagram in just a moment. And so when it detaches, it can actually pull on the retina and give you 3 things that you should know about: flashing lights that look like lightning, rain when there's no rain, and those are the cells that are coming from the retina, or a curtain that obstructs your vision and you can't see through from any direction, up, down, sideways. That is significant. And that's when you should see an ophthalmologist or an optometrist. Have a dilated exam with scleral depression where you push on the outside of the eye to see the edges that normally you can't see. And then a retinal surgeon or a retinal specialist will have to get involved if there really is a problem, a tear, for either laser or pneumatic retinopexy, scleral buckle. They'll talk to you about that.
But I'll tell you my perspective. So I see many people over the age of 50. They'll come in with these sudden symptoms in one eye. They can't figure out why they keep seeing this thing floating around, maybe some flashes like you mentioned. My staff is instructed, anyone that calls the office with those kind of symptoms, we want to get them in right away. Because although it's very common and most people are okay, rarely, I mean, you look at the stats, it's anywhere between 4 and 15%, depending on the study, someone could have a retinal tear. And if you have a retinal tear, that can lead to visual loss. And that's when, as Carl mentioned, if I see the person, I'm a general ophthalmologist, I'm looking for a retinal tear. I'm dilating their eyes, I'm taking a good look. And if I see anything, I'm having them see my retina doctor right away. Most of the people, fortunately, don't have that, but then we still, as Carl and I could talk about, we monitor that. Maybe we see them back in 2 weeks, 4 weeks, 3 weeks, depending on what we feel in terms of the risk. But we emphasize to all those people, if your symptoms start to get worse. So if you start out with, like Carl was mentioning, some floaters or flashes, and then you see a curtain, that could be a retinal detachment. You got to get in right away.
Right. And so again, most of the time you don't even recognize it. And after about 3 months, your brain suppresses the image so you don't see it. But if you do see those flashes or rain or a curtain, that can be trouble, and we want to see you. And it's really so common. Again, the number can be 70% of people over 70. So I'd like to show you the anatomy that I did in the floaters video, just to give you a sense of what we're talking about. So this is the schematic diagram of the eye. Here's the front part of the eye. This is the pupil. This circle here where light gets through. This is the iris. This is the lens. We talked about a cataract before. Here's the intraocular cavity where the vitreous gel exists, and it adheres to the macula, the optic nerve, and some of the blood vessels. When it separates, we don't want this retina, this layer here, it's like the film in a camera, to separate. That's when we get concerned, and we want you to come in for a dilated exam.
Yeah, so the gel is detaching from the retina in most people. Most people, when we look in the eye, we'll see that the gel is separated, but the retina is still okay. And then very rarely when we look in there, we see the gel is separated, but along with it, it pulled on the retina and caused a tear or a detachment.
Right, right. So that's our video on posterior vitreous detachments or PVDs. I want to thank you. I want to thank my friend John for his explanation.
When are you coming to Jersey? When are you coming to Jersey?
Right, it's a long
Come
trip.
visit me. Come visit me here.
Gotta get my dog team out. I gotta sharpen those skates. But everyone, like and subscribe. Please make some comments. We really appreciate you, curious folks, and we'll see you on the next video. Thanks, guys.
Yeah.